Good morning. On behalf of Mayor Jim Watson, the Ottawa Board of Trade, and the Ottawa Business Journal, welcome to the Mayor's Breakfast for April 2021. I'm Michael Curran from the Ottawa Business Journal. This April episode of the Mayor's Breakfast is particularly timing as public attention is squarely focused on the pandemic. The Ottawa Hospital has been ground zero when it comes to treating COVID-19 patients. For 13 months, its doctors, nurses, and medical staff have toiled day and night to save lives. This Mayor's Breakfast features a discussion with the hospital's president and CEO, Cameron Love, who took the leadership role on July 1st, 2020. Tough timing. Cameron will be interviewed by my colleague at the Ottawa Business Journal, Mark Sutcliffe. Don't miss that discussion coming up in about 15 minutes. Also coming up, my regular interview with the president and CEO of the Ottawa Board of Trade, Su-Ling Ching. And of course, Mayor Jim Watson will be here for his update on City Hall. As we kick off today's show, let's recognize the great organizations that support this speaker series. Our lead sponsor is Hydro Ottawa, Commissionaires Ottawa, the Westin Ottawa, Algonquin College, La Cité, Rogers Communications, RBC, Enbridge, Oakwood Designers and Builders, Royal LePage Commercial, Capital Office Interiors and Steelcase, the Ottawa Senators Hockey Club, and the Centurion Conference and Event Center. A big thank you to all those sponsors. And now a message from this morning's presenting sponsors, the Westin Ottawa. Here is Ross Meredith, dual general manager of the Westin Ottawa and the Delta Hotels by Marriott Ottawa City Centre and Marriott International. Here is Ross Meredith.
Good morning. Hi, I'm Ross Meredith, General Manager of the Westin Ottawa and the Delta Ottawa here in our great city of Ottawa. Thank you for allowing me to be the presenting sponsor this morning at the Mayor's Breakfast. And what an honor it is today to be here in support of and in front of Cameron Love and the great work at the Ottawa Hospital. You know, I can truly say from the bottom of my heart and the hearts of all our associates at the two hotels and our industry that there's been phenomenal work and continues to be phenomenal work on behalf of your colleagues and the healthcare workers throughout the city of Ottawa, and the phenomenal work that you have done and continue to do on our behalf for all the citizens. So a big thank you and a big shout out for the great work. I guess the only disappointing news is there's still a little bit of work left. There's no doubt that we have some time left in this pandemic, but we're at a finish line. The vaccine gives us a finish line, and I'm confident that we will get there sooner than we think. As far as our industry and as far as our work at our two hotels and the work at our Ottawa hotels, it has been an extremely devastating time. Without a doubt, hotels are operating at either closed, a number of them remain still closed, or at occupancy levels of 5 and 10%, down from what was typically 70 or 80% occupancy. So the days of conferences, groups, meetings, weddings, the hustle bustle of arrivals and departures, those days have gone, and we are waiting for them to return. But I do think that day will come, and I do think it will come quickly, and it will come, I think, within the next few months. As we get past this last little hiccup, we're going to want to get back to weddings and conferences and staycations and meetings and social activities, celebrating each other and celebrating our industries and our partners. So my ask is that, and my request and my ask is that when that time comes, that you give us an opportunity to come back to our hotels. We have two phenomenal hotels here in Ottawa. Phenomenal pools for staycation, great meetings and conference space, the two largest ballrooms in the city. We are ready to do business when you are. And we will do it with an enormous amount of pride and an enormous amount of contribution and delivery. Our associates are excited to get back to doing what they do best, which was take care of our customers. And we look forward for that day. So thank you again. Thank you, Jim and the Mayor and the Mayor's team for putting on the Mayor's Breakfast. We wish you all the best this morning and for the many months ahead.
Well, thank you, Ross. We need to endure this pandemic a little longer before we can get traveling and hopefully pack those hotels of yours. Wishing that day comes very soon, Ross. Now let's welcome my partner in producing this event, the president and CEO of the Ottawa Board of Trade. Here is Su-Ling Ching. Hello. Good morning, Su-Ling.
Good morning, Michael.
So listen, it's been, oh my goodness, it's been a jam-packed month. I can't believe how much has gone on since, in a sense, it's Groundhog Day, Su-Ling, and nothing's happened, but in fact, a lot has happened. So let's just start off by catching up with you, Su-Ling. What have you been working on and the Board of Trade been working on since we last spoke at the Mayor's Breakfast?
Well, thank you for asking. I'll try and give you just the highlights. So, of course, we had worked with the mayor and many of our local economic partners in creating the mayor's economic recovery and rebound strategy. And so I know that was presented to the city, and we were happy to support that and to work with our partners on moving forward toward recovery. We had our Queen's Park Day with the Ontario Chamber of Commerce colleagues. Typically, we go for a day to Toronto to meet with ministers and all of the leaders across the political parties. This time, we did a virtual Advocacy Day series, and so that was extremely valuable in terms of being able to make some more connections and also to reinforce the recommendations that we've been making to the Ontario government. And then, of course, we had the post-budget breakfast last week, and we hosted Minister Fortier, and we had some fantastic panels. And we were excited to see a lot of the things that we had been asking for the federal budget come through, both in terms of helping us get through this fight against COVID, but also provide a strong foundation for moving forward.
It's good to know that you've got the full attention of both the provincial and federal politicians, Su-Ling. Mm-hmm. So, of course, we're still in a stay-at-home order. We're in a state of emergency. We're still locked down. Mm-hmm. That much hasn't really changed. Give me a sense, though, as hopefully we come to an end to this stay-at-home order and lockdown. What mm-hmm. can be done to start preparing for a reopening?
Well, we all have a part to play. So for the part of the government, we've asked for continued support for businesses to get them from here to there. We've asked for support in terms of getting rapid testing out for businesses to use. All of us need to be following the protocols to continue to support local and download the COVID app so that we can continue to do contact tracing across the country as we reopen and start to build the economy back. And for businesses, there are tons of programs out there that they can be applying for, not just to grants to help them get through, but also access to capital and programs to help them build the business, transform where necessary in terms of marketing online and digitization and those kinds of things. So we're going to be relaunching a program that we did last summer with our colleagues at the Canadian chambers across the country called the Post Promise. We're going to be partnering with the city to relaunch that, where businesses who have really committed to making sure that they have safe protocols for customers are able to declare that and that we're able to promote them. So I encourage businesses to look forward to that. And as well, we are continuing to work with the province on how we can create a framework that will take us through reopening and into the future as well for safety protocols.
And if we look even farther down the road, Su-Ling, mm-hmm. about, an economic recovery, mm-hmm. What is the Board of Trade doing to try to prepare us for that stage?
Well, definitely asking the government to be very targeted in how they invest for the future in high return areas of our economy. There's that, and then planning locally with our economic stakeholders. And Michael, we're so excited about the upcoming City Building Summit as an opportunity to start thinking about the future of Ottawa, how we can work together and what those priorities should be. So we have some fantastic speakers and panel discussions coming up. And one of the things that really struck me when I was meeting with some of our local city builders and some of our keynote speakers is this idea that we all have a part to play. In fact, our keynote speakers topic is called Own Your City. And it's about how collaboration is a key competitive edge for all of us. And if we don't have it, that it's also a risk, that we have a neat opportunity at 1 million in our population to grow exponentially in the coming years, and that we want to make sure that we're prepared for that in our planning and that we can reach our full potential.
I should point out the City Building Summit happens tomorrow. So that's April 30th, Friday, April 30th. And I think people can still get tickets. It's very last minute at this point, but you can go to ottawabot.ca, go to the events page and register there. Do so soon, please, because our event planners have been working on this for weeks and months. And as we wrap up, Su-Ling, you know, we want to be realistic about the state of the economy, but we have a little bit of an optimistic, I think, announcement coming up next week. That's the big announcement around the 2021 40 Under 40 recipients. Are you excited about that?
We're really excited about it. And you're quite right, Michael, you know, to continue to celebrate the excellence in our community. And it's really, there's something exciting about recognizing the young leaders in our community, you know, that next generation of change makers. And so we're looking forward to that excitement for sure.
And that should be coming up on Monday, fingers crossed, maybe Tuesday if we hit a hiccup. But again, it'll be the 2021 announcement of the 40 Under 40 happening next week. So please watch both Ottawa Board of Trade social media channels and OBJ social media. And we'll have a little video a special video for the first time ever, by the way, to announce the recipient. So looking forward to doing that with you, Su-Ling. Wishing you continued strength and health, Su-Ling. Thank you for this.
Thank you.
Well, thanks so much to Su-Ling Ching, the volunteers and the staff of the Board of Trade. They're working so hard to keep advocating for local business. Before I welcome our host, Mayor Jim Watson, please watch this brief video message from today's second presenting sponsor, Hydro Ottawa. Here is the president and CEO of Hydro Ottawa, BRYCE CONRAD. Take it away, Bryce.
Good morning, Mr. Mayor and distinguished guests. It's an honor to be here this morning with Mark Sutcliffe and Cameron Love, who are both community leaders that give so much of their time to make Ottawa a better place to live and work. Once again, Hydro Ottawa is proud to be a presenting sponsor of the Mayor's Breakfast Series this year. I'm happy to be joined this morning by so many of my colleagues from Hydro Ottawa who are obviously here virtually. In addition to providing a safe and reliable supply of electricity to the residents and businesses of Ottawa, we also power our community's essential institutions that help keep us safe and healthy. It's a responsibility that we don't take lightly, especially in these challenging times. But we know that to help build a vibrant capital takes more than power. It takes a great deal of heart, time, and generosity. For the employees of Hydro Ottawa, it's important to give where we live. And supporting our city's hospitals is just one of the many ways that our team here at Hydro Ottawa does that. Year over year, our workplace charitable campaigns raise hundreds of thousands of dollars for the United Way and the Ottawa Hospital. Equally, our customers have contributed generously through our paperless billing campaigns to raise much-needed funds to purchase critical medical equipment and supplies, to donate to youth mental health at CHEO. Now, Cameron, I know I owe you the last fundraising installment to honor the $1 million we promised the Ottawa Hospital in 2016. And while we had to cancel our charity golf tournament due to COVID-19 last year, my sincere hope is that we'll have the opportunity to complete that 5-year commitment this year and send the remaining donations to support the hospital's remarkable Rose Ages Breast Health Center. This partnership has been one of the proudest of my careers. I look forward to finding other opportunities in the future to support the important work the Ottawa Hospital does. As a community company, Hydro Ottawa is passionate about giving back and building a healthy, sustainable, and caring future for Ottawa. I know it's a vision we share with all of you here today. With that, I wish you all a good morning. Thank you for having me. Please be safe.
Well, thank you very much, Bryce. We appreciate the support and important role of Hydro in our city and region. Now, without further ado, it's time to welcome our host, His Worship, Mayor Jim Watson, for his update from City Hall. Over to you, Mr. Mayor.
Hello everyone, bonjour tout le monde. Je vous souhaite la bienvenue à ce petit déjeuner virtuel du maire ce matin. I want to welcome everyone to this virtual Mayor's Breakfast. Thank you to our partners at the Ottawa Business Journal and the Ottawa Board of Trade, and everyone who has assisted in setting up this event. I'm pleased to welcome our guest speaker, Cameron Love, President and CEO of the Ottawa Hospital. Thank you, Cameron, for participating in today's breakfast. As many of you know, the number of confirmed COVID-19 cases in Ottawa is increasing at an alarming rate. We've recently seen numbers well into the 300s, And also hospitalizations and the number of people in the ICU have been increased steadily over the last few weeks, and we are, of course, concerned. We're also seeing, particularly with the variants of concern, younger residents getting sicker with the virus. Our healthcare capacity is in a vulnerable state right now, and I want to take this opportunity to thank all of our hospital staff in Ottawa, including those who work under the guidance of Mr. Love, the Ottawa Hospital, for their tireless work and incredible dedication. I also want to thank all healthcare providers and frontline workers in our city. I've said this before and I'm going to say it again today, but we need to work together as a community to reduce the transmission of the virus. This is everyone's responsibility at the end of the day. We all need to continue to follow the provincial stay-at-home order and only go out for such essentials as going to work. If you can't work from home, going to the grocery store, accessing healthcare services, picking up medication at the pharmacy, and getting some exercise outdoors. Now is not the time to make exceptions to this guidance, and it's in everyone's best interest to stay at home as much as possible and limit your personal contacts. We understand that everyone is getting tired and that COVID fatigue is settling in. This past year has been difficult, but we need to continue to stay the course and follow public health guidelines. I say need because it is a necessity. We cannot let our numbers continue to rise like they have been if we want to have a better summer and fall where some of our restrictions can then be loosened. The province of Ontario has extended the stay-at-home order and has also restricted interprovincial travel, some recreational activities, and capacity limits on retail stores, including big box stores. The province is also prohibiting outdoor gatherings with people outside of their own household. The goal of these regulations is to reduce the dire situation in our province and reducing transmission of COVID-19 by limiting the crowding of people as well as behaviors that continue or that could contribute to the spread of the virus through social gatherings with those outside of your immediate households. We can only get through this situation by following the provincial orders and public health guidelines. We need everyone's cooperation. We have brought our numbers down before, and I know working together we can do it again. Finally, before I introduce you to our guest speaker, I want to encourage everyone to continue to support our local businesses. These times have been extremely difficult for local business owners who are doing everything they can to make ends meet. Order takeout from your favorite restaurant, support your favorite local shop by ordering from their website, or purchase gift cards for loved ones from your favorite local store or service. Our local businesses give so much to our community year in and year out. Now it's our turn to support them in their time of need. Now, without further ado, I want to introduce you to today's guest speaker. Cameron Love is President and CEO of the Ottawa Hospital, one of Canada's leading academic health sciences centres. He took on this leadership role as of July 2020 in an unprecedented time as Ontario's health system adopts to a new service model in the wake of COVID-19. Cameron is an inspirational leader, dynamic and engaging, who leads through collaboration and mutual respect. He's determined to continue building the Ottawa Hospital's reputation as a global leader in healthcare, research, and education, improving the lives of people in our community, province, and country. The hospital's core values of compassion, teamwork, commitment to quality, and respect for the individual are bolstered by Cameron's passion and integrity, which he's applied in healthcare since 1998. Cameron served on the transitional leadership team that guided the merger of 5 local hospitals, leading to the creation of the Ottawa Hospital, and the integration of its programs and services across several campuses. Strengthening the integration between the hospital and home care, Cameron served as the interim CEO of the Champlain Community Care Access Centre to focus on improving the delivery of home services in the community. Through this experience and as Executive Vice President and COO of the Ottawa Hospital since 2014, he was responsible for the leadership and oversight of programs and services across hospital and their integration into regional programs throughout the Champlain region. Cameron has a Master's in Health Administration and training at the Wharton and Telfer School of Businesses, as well as a bachelor's degree in biology and psychology. Cameron is active in the education of aspiring healthcare executives as a preceptor to residents in the Masters of Health Administration program at the University of Ottawa, for which he received Telfer's MHA award. Cameron is also involved in many regional and provincial initiatives, committees, and task forces and sits on several boards that promote the health and well-being of the people in the region. Thank you, Cameron, for being here today. I'm now going to pass it over to you.
Hi, everyone. Thank you for joining us. And Cameron, thank you to you for being part of this today. And I wanted to say as well to you and everybody at the Ottawa Hospital, on behalf of my family, on behalf of the whole community, thank you for the amazing work that you're doing right now. It's so critical and it's so much appreciated by everyone in this community. I know it's been a really challenging time for you and your team. So thank you for what you're doing.
Oh, thanks for that, Mark. And it's great to be here and good to see you again.
So let's talk about what's happened over the last year. And maybe we can start in particular with what's been happening very recently. We have seen a rise in the infection rate in Ontario, in Ottawa, and we've seen the rollout of vaccines as well. But I think a lot of people felt that around now we'd be in a better place than we actually are. So what are some of your observations about that, and how's this affecting the hospital and the people who are working there?
Yeah, so I think it's probably the most concerning period of time we had over the last 15 months with this pandemic. You know, when you go back to the very beginning and around Feb and March, there was a huge amount of concern with what was happening across Italy, and then it came to New York, and it was a foregone conclusion that it was going to be in Canada, and we were probably going to have that type of impact in Ottawa. So the first wave was really around bracing for what they saw in New York, with hundreds of people in ICUs, lots of people in acute care hospitals, and just significant rates of COVID. And so those first 2-3 months was really around that preparation. We scaled down services, we ramped down, we reallocated staff, we got lots of PPE, and we could ventilate upwards of 200, 250 patients. Thankfully, in that wave one, though, we saw very little. And through the life of this pandemic, from let's say last March until about January this year, we always had somewhere around 15 to 25 COVID patients, which in a place like ours that has 1,200 beds is very, very manageable. And so after the first wave, we ramped back all of our surgical services. We were trying to catch back up on that backlog and making tremendous progress. And as a community, we really hadn't seen massive rates like you saw across the world in terms of percent positive cases per day. January, that took quite a significant turn. And while we started to see rising pressure in the emerge from things like non-COVID activity, and we see a lot of activity in winter months, you get exacerbation of disease, a lot more trauma, people fall and break more bones on the ice. And so we tend to see more activity. But what we started to see, particularly in Toronto, was some really concerning rates. And places like Trillium and Humber and UHN, it wasn't whether they had 20 or 30 patients, they had 100, 150, 200 patients with COVID in the hospital, each hospital. Over the last few weeks, that has started to become more concerning in the Ottawa situation, where we're seeing, we were concerned in around January of where we're going in the red zone of an 7-day average of 39.5 to 40 positive patients per day. The last 2-3 weeks, we've been over 300. And so when you talk about impact of COVID in this community, this wave by far has been the greatest impact. And when you're seeing numbers of 300 plus, you can pretty much assume that you're going to have more hospitalization. That's exactly what we've seen. So for the last week, we've seen, somewhere in the range of 60 to 70 COVID patients, 20 to 30 in ICU. And while we still have very good capacity, we have taken precautions, assuming this is going to get worse, to create more capacity. So if we have to ventilate more in ICU, if we have to admit more from an acute care perspective, we have all the capacity, all the staff in place, and all the equipment in place. And so we're very much ready for that. And while it's been tremendously hard on the staff to reorient that way, people have really kicked in to help be prepared. But I think the most important thing is as a community, these restrictions are critical, because if we can get our numbers from 300 plus per day back down to 39.5, you'll start to see the hospitals decongest. We'll get ourselves back to green. We can open up a little more, and hopefully by then the vaccines have progressed even further.
Yeah, and just on that point, we can talk more in a moment about the impact this has had on the hospital and the how you're managing your way through this crisis as an organization, because I think that is really interesting. But I think a lot of people are feeling very discouraged right now, and where they expected to be at this point doesn't compare to where we are. So is there is there a hopeful message? You just mentioned if we do follow the restrictions and if what's in place now starts to work and more people are vaccinated, is there reason to be hopeful?
Yeah, 100%. If you look at wave one, let's say wave one and wave two, the hardest hit sector of healthcare and actually a population in every city was long-term care. If you recall, Mark, from the first wave, we had a lot of deaths in long-term care across the province. We saw huge outbreaks in terms of, 3/4 of a home with COVID, lots of admissions to hospital with transfers because of COVID. If you look during this wave, and I think the government was smart in this direction of prioritizing, because the elderly are the most vulnerable from the virus. In this community, every single long-term care patient has been vaccinated, both first and second dose. Every single staff member in those organizations, everybody that was willing to take it, has had their first dose. And what we've seen in this wave, while we're seeing 300 plus per day, and while we're seeing lots of people in hospital, we virtually have no COVID in any long-term care home. I believe I'm right on this, but over the last 2 weeks, I know of one case, which was a staff member that got COVID that didn't refuse to get the vaccine. So at a very summary level, what that means is the vaccines do work and they make a dramatic impact. So the catch here is that unfortunately we're in this wave. Everybody's always been asking me, are we going to have a wave 4? I don't know the answer to that. What I can pretty confidently say is if we can get herd immunization in this community, let's go with 70 or 80% of those above 12 vaccinated, we will see significant drops in rates because you've seen that across the world, particularly in places like Israel. And getting those vaccines out and getting everybody a first dose by summer is something to be very hopeful about, and it will see the rates drop.
Yeah, and that, it's changing all the time, but that's something that, could happen by June potentially, right? Something in that time frame.
Yeah, and I think that's been a part of the frustrating challenge along the way is threefold. One, it's people have lost a lot through this pandemic. People have unfortunately lost their lives, or families have lost loved ones. People have lost jobs. The economy has taken a bit of a hit with businesses as they've had to open and close. But I think as we get through this over the course of the next few months, and the supply chain has been really volatile, but it has gotten better. While it seems to have gone up and down with the supply chain of vaccines, based on where the current run rate is, and that doesn't mean there's not risk that it'll fluctuate, it is very feasible to get everybody done by June with the first dose, and then second doses will occur through summer and into fall.
So Cameron, you're, in addition to running a vital healthcare organization and dealing with the challenge of the coronavirus itself, you're running a large organization. You're running a team of people. You're leading that team. You're faced with some of the dynamics around some people working remotely, some people working in person. What are some of the challenges that have arisen for you and the leadership team at the Ottawa Hospital, and how have you been responding to them?
Yeah, so it's a great question, Mark. The one thing we're pretty fortunate of in Ottawa, and actually in Ontario, but particularly in Ottawa, is how resilient and how committed healthcare workers are to the health of this population. As a trauma center, over the last 25 years that I've been here, we've dealt with a lot of crises, whether it's the ice storm, the shooting on the Hill, the bus crash, those types of things. And when they happen, one of the real silver linings to a place like this is how quickly people respond to help. The big difference with this one is the duration. And so it has almost been like a crisis mentality in terms of a response over the course of the last 15 months. And particularly in that first wave, in those first 3-4 months, it felt very much like how we try and rally in terms of responding to all the traumas coming in from the bus crash. But as it became very clear that this was going to be a very elongated process, I think there were 2 or 3 challenges as a leadership team we faced. Number one, it is hard to really engage with people when you're doing it through technology like this. I mean, it's great that we have Zoom and we have Teams, et cetera. But when you've got leadership teams that are having to work through this in a virtual environment, when the reality is our history has been very much built on the social aspects of healthcare and really that bonding that occurs, we've had to put different mechanisms in place in terms of how our leadership team supports the teams on the floors. Obviously, our managers and our directors are on site, but there's a lot of people that aren't on site. So we've kind of become accustomed a little bit in terms of how we engage fully these virtual platforms. I think the other real big challenge that we've really had to really rally around, and the reality is the only way healthcare works is because the people committed to doing it. But the healthcare workers, this has been a really long haul on people. And I think it's not only hard when you're, particularly at the beginning, when you don't know what this virus is about. You see lots of healthcare workers, unfortunately, either getting it or dying across the globe. Your first inclination is, and rightfully so, am I going to be safe in this job? And so those first 3 months was really around making sure all the tools, equipment, PPE, people were well supported. After that, people started to get into a groove and running with this, where they did feel safe to some extent. But the workload demands are heavy. If you're a nurse or a physician on a floor and you have to change in and out of PPE, 50 times a day, and you have a different set of protocols, it's very different than what people are accustomed to over the last 25 years of running on an inpatient unit or in an OR environment. And so a lot of that has been, how do we support the wellness of the workforce? And what we've seen with this, and we spent a lot of time, and it's probably the predominant thing that I think we spent the most amount of time on, is how do we engage to make sure people feel supported and they have what they need to keep their balance in work life. And that is one that I think is a challenge for all of us. But with healthcare workers, not only demands of in hospital, but people have lost loved ones, childcare, all the things that give them balance outside of work has also been completely disrupted. And so your work life internally, and whether you're safe or not, plus your own home life, that is the piece we have spent the most amount of time on trying to structure wellness programs, because we respond to things pretty quickly. It's just what we do as a trauma center. But that is something very different that has probably been the biggest challenge for teams. And I think it's probably been the biggest challenge for many businesses across the globe, and definitely in Ottawa.
Yeah. And can you shed some light on your decision-making process in a time like this? Because you're dealing with all kinds of different inputs, including projections about the future, which are they're projections, they're not predictions. So how do you make decisions in a time like this?
There's two words that come to mind that probably drive most of what we do, which is flexibility and speed. You don't have, particularly in something like a pandemic, you don't have the luxury to do, a 5-month statistical analysis on something to determine whether it's right or not. Now, fortunately, we have lots of data, and we've got lots of really good sort of research and epidemiologists that can help drive some of the decision making. But we set up pretty much an IMS structure, an incident management structure, where every single day for the last almost 15 months now, we took a pause for the summer when we thought it was getting better last summer. But even now, every single day I have a senior team that meets at least once in the morning, usually sometimes in the evening, just in the status of where we're at. So it's built very much like a command center model. And there's a couple reasons for that. One is because things can shift extremely quickly on site. So if I look this past week, we had to make decisions of whether we were closing down elective surgery to reallocate staff to support the ICUs and acute care within about a 24-hour span. Something like that in the past, of whether you're scaling up or down elective surgery, you usually do about 3 or 4 months of assessment and impact, and can we find alternatives? So we use very much this incident management approach where we're meeting each day, and we look at between logistics, equipment, staffing, our clinical services, and where some of the risks are and what are we doing with wellness. That is pretty much the standard agenda that runs each and every day. And we've been managing like that throughout. The other reason for it is the directions coming out of the province, they change weekly. And that's not a criticism to the province. I think what it speaks to is when you're in the middle of a pandemic that no one has ever lived through, and you've got some volatility in terms of what's happening with your rates, your projections, some of the issues around PPE like we had at the beginning, the province has an incident command center. And so they've got an incident structure right now that manages critical care and directions. And we've got things like shortages of drugs. Here the TOSI drug floating around locally, around shortages across the province. Decisions come out very regularly on what the province is directing, between things like vaccines, public health directions, directions on whether we're getting patients out of Toronto. And so you have to have a structure that responds to that. And so we have the senior structure, and then it fans out into our medical administrative leadership daily. And it's been tremendously successful. We've done it for years, particularly like the same structure we used when we had the bus crash.
Right.
We just, on those ones, you bring them up and you take them down in about 72 hours. And this one, we brought it up and we haven't taken it down. And so it achieves the same purpose, and it allows for a lot more effective communication, which is the third piece, Mark. I think the biggest challenge in these things is people know what they're doing medically, people know what they're doing technically. with the directions changing very regularly, you have to have a robust communication process. And so we're sending out daily notes, weekly notes. We do town halls and open forums all the time, just trying to make sure people are informed, because it gives some stability and some comfort in terms of how we're managing through this.
All right, I want to talk about the future of the hospital and, of course, the new campus for the civic campus that is being planned. But just before we go to that, any quick final thoughts for people in the business community in particular about where we are today and where we're going with the pandemic?
Yeah, a couple of thoughts. First is a big thank you. You know, throughout this, from the beginning of the pandemic, local businesses have helped us and supported us tremendously. The number of local businesses that have offered to help, at the beginning it was manufacturing or producing PPE, dropping off food, supporting our assessment centers. It has been nothing but support out of the business community. And the reality is, when you're in the middle of something like this, you know, you can be a great hospital, but this only functions if everybody rows in the same direction. And we've had tremendous support out of the business community. So I really want to thank people for that. And the other piece is, I know how tremendously hard this year has been on the business community. I've been in this community now for 25 years. I can't think of a time where we've had a bigger impact on the businesses like we have this year. And some have opened, some have closed, some have definitely taken a significant hit, and it is a very long haul. What I would tell the business community is, you know, you can't be 100% sure on everything, but based on what's happening across the world and based on what we're seeing, I think if we can get through into the summer and get these vaccines rolled out, I think we're going to see far more stability in terms of the impacts of COVID, not only in Ottawa, but in this province, which starts to bring back the ability to hopefully recover from the pandemic, not only in hospitals, but definitely in the business community. And I know that's going to take some time, but at least it's a hopeful starting point.
Yeah, for sure. Thank you for that. And we all have that to look forward to. And you know, I think this year has been a time when we've all realized what's really important. And I've said many times before that one of the most critical things for any member of the community, but particularly for people in the business community who are building their companies, who are investing in Ottawa, who are hiring people and bringing them to this community, healthcare is so critical to having a great community, and a world-class hospital is so vital to healthcare. So tell us about the plans for how healthcare is going to evolve in the future in our community.
Yeah, I think we've, you know, there are a few silver linings that come out of a pandemic. They're hard to find, but there's a few of them. And I think as we've, you know, one of the real bright spots is over the course of the last year, while we've had some stops and starts, we've kept on the planning for the new Civic, which we've had nothing but support out of the governments. And our plan here with this new Civic is to get through the next design phase and be out to RFP 2023, which the government has endorsed and announced, and then be under construction by 2024. Having said that, I think when I look at this project, there's no question it's a big hospital development project, but what's more important is it's a significant healthcare transformation project. So if you look at the Ottawa Hospital, we do about 80% of the adult acute care for this entire region, which is from Barry's Bay to Hawkesbury down to Cornwall and all of Ottawa. The Civic is a real focal point in terms of the health of the population with the programs it runs on the site. So whether it's all of our neuroscience program, vascular surgery, all of our trauma programs, complex general medicine, there's a whole series of programs that support this community. And part of what this is not only is it a significant healthcare transformation project, it's probably one of the biggest projects that Ottawa will ever do from the point of view of development and economic driver. It's about $2 billion worth of construction, about 2.7 billion in terms of total project cost, and it is really going to be quite a spectacular landmark project for this city and for this region. So those are sort of some introductory remarks, Mark. Yeah. But I think the big piece that we've learned over the last year is the importance of healthcare infrastructure to the health of this community, and particularly during a pandemic. So when you talk about infrastructure such as private inpatient rooms, in terms of managing disease and viruses in isolation, if we had 100% private rooms, it's not that we haven't managed tremendously and we know how to manage outbreaks, but having a world-class center like you see in other parts of the world or the planet, all private rooms makes a massive difference. We've also learned a lot in terms of how you deal with how you set up and design a new world-class center in terms of what happens should we have another pandemic. And I'm really hoping we don't, but I don't think it's going to be another 100 years before, we've had SARS, now we've got COVID. It's probably not going to be another 100 years until we have some other type of virus that as a population we've got to manage through. The capability of what this campus will allow for that when we open 2028 and the one that comes in the future is far better than the way we're structured today. And then I think the third piece that is tremendously exciting is the opportunity to innovate and really be innovative and thoughtful from an innovative perspective in this design is something that we've spent pretty much the last year and a half, 2 years looking at. And the pandemic has changed our thinking. I'll give you one very simple example. This is why it's really around healthcare transformation. Pre-pandemic, if you look at ambulatory care, we do about 1 million visits a year, give or take a few. All of them were, 100% of them were coming face-to-face visits. When the pandemic hit and we didn't have the choice to do face-to-face, we moved on to a virtual platform. Probably 80% on average, some services are higher, some are lower, of what we do for ambulatory care now is done virtually. Patient never leaves their home. We can monitor them remotely. The specialists can consult with them. We can order their drugs to be delivered. We can get diagnostic scans very close to their home as opposed to driving in all the way to the hospital. It has completely reoriented what we're going to do for an ambulatory care platform. So if you have a patient that comes in with a stroke, we will make sure they get the best care, the best technology, get them through their acute phase, send them home. But based on this virtual hospital concept that we've now developed into the development of the new Civic, huge portions of them will never have to leave their home. And they're all electronic charts. They can get all their information, everything they need from home, from their iPhone. That type of innovation is what's going to change the platform of healthcare as we develop a world-class center so that, unfortunately, we're going to have trauma. We're going to have people that need neurosurgical procedures, vascular procedures. The capability of what this building will be able to do will be far better than what we had for the last 50 years in this city. But it'll be fully integrated once the patients leave the home, which is very different than what we do today. So it really is quite exciting from the point of view of managing healthcare. And when you think about a major milestone project, whether it's, you look at the Shaw Center, you look at Lansdowne, you look at some of these other major building projects, this one I would argue is probably going to be one of the biggest projects in Ottawa, at least for the next 25 to 50 years.
That's amazing. Yeah, and as you say, it's an economic development driver. It's a world-class health institution. It's going to be so innovative, and it's going to be such a dramatic change and such a great opportunity for our community. Something really to look forward to beyond the end of the pandemic. Cameron, thank you so much for your time today. Again, thank you to you and the team leading the Ottawa Hospital and to all the people working there for the incredible work that you're doing to save and protect so many people in our community right now. Really appreciate this.
Great. It's good catching up, Mark. Take care.
Welcome back. I hope you enjoyed that discussion between Mark Sutcliffe and Cameron Love. To demonstrate our appreciation, a gift will be provided to Mark and Cameron from Royal LePage Commercial, our speaker gift sponsor. A special thank you to Matt Jacques from Royal LePage Commercial for his support. Before we wrap up today, I want to provide you with a few highlights from the Ottawa Business Journal. Just a few days ago, Ottawa Business Journal launched its quarterly print publication, a digital publication too. It's a big, thick 80-page newspaper. By the way, we think it's the biggest newspaper we've published in nearly a decade, so that's a success in itself. Our cover story is fastest growing companies. It's also has feature sections like HR Update, Best Offices Ottawa, OBJ Regional, and Techopia. That's all jam-packed into that print issue. If you're interested in getting that issue, by the way, delivered to your home, I urge you to go to obj.ca/delivery, and you can pay a small delivery charge for that. If you'd prefer to read the digital edition, you can go to obj.ca website, scroll all the way down, and you'll see a thumbnail at the bottom of the website for this month's edition. As we wrap up the April Mayor's Breakfast, let's recognize our sponsors one more time. Our lead sponsor is Hydro Ottawa, also Commissionaires Ottawa, the Westin Ottawa, Algonquin College, La Cité, Rogers Communications, RBC, Enbridge, our global sponsor, Oakwood Designers and Builders, our speaker gift sponsor, Royal LePage Commercial, our coffee sponsor, Capital Office Interiors and Steelcase, Our door prize sponsors, Ottawa Senators Hockey Club, Go Sens Go, and our caterers, the Centurion Conference and Event Center. The Mayor's Breakfast will return in May with another great show focused on our tourism industry. Please visit ottawa.bot.ca for more details. A big thank you to Rogers TV, especially Gavin Lumsden, for its great support in producing this breakfast series. On behalf of OBJ, the Ottawa Board of Trade, and of course Mayor Jim Watson, thanks for joining us. See you in May.